I'm Kay Walker, and welcome to our Top 10 series. I am answering your burning, most frequently asked questions from my depression angels. This question comes from a concerned parent who's wondering what medications are the most effective for treating depression in teens. Well, let's talk about that. There's so many things that you need to understand when it comes to medication and teenagers. And I'm going to speak about teenagers, but I'm including children in this discussion too. So if you have someone who is younger than 12 years old and a doctor is suggesting they're on a medication, I'm speaking to you as well. When it comes to the FDA and antidepressants for teens, they have approved antidepressant medications for teens, but in their studies, what they found is that 4% of teenagers who take antidepressants will have an increased risk of suicidal thoughts. They'll start considering suicide more, and their situation may become more severe. Now, in clinical trials, no one died, there were no issues, there were no major problems. However, the FDA concluded that 4% was enough of a concern, enough of a number for them to put what's called a black box label. That means all antidepressants come with a warning, and the warning is that some teens and children who take antidepressants may deal with an increase of suicidal thoughts. Okay, so that's important, and a doctor will point that out to you as well. Now, the FDA has approved 2 drugs specifically for treating depression in kids and teens. Those drugs are Prozac and Lexapro. Doctors, however, can use their judgment and prescribe any antidepressant. This is what's called going off-label, and this is when a doctor uses their own judgment. So if your teenager has been prescribed something else other than Prozac or Lexapro, the doctor there is likely making a judgment call based on the specific case, the specific situation. Now, why I personally don't like the idea of meds in teens. I like to consider every other alternative prior to putting anyone on a medication. That's my golden rule, my advice. Unless they're such a severe case and they've been considering suicide and they've been depressed for a really long time, then sometimes an antidepressant is a really, really great option. When it comes to teens specifically, it's very important to keep in mind that their brain is not fully developed. The human brain is not fully developed until our early 20s. At this point, the brain is still changing, the brain is still growing, it's still developing. So there's a bit of a concern that a teenager may be taking something that can alter their brain chemistry. I talk about antidepressants in my Lead with Love course in greater detail. Here's what you need to know about antidepressants: that they may alter brain chemistry over time, that there will be anatomical brain changes that occur if someone takes an antidepressant. So that's why I'm not as keen about a teenager taking them. But before you put a teenager on an antidepressant, I would try alternatives first. You want to make sure that they're eating a well-balanced diet, healthy diet. You want to make sure that they're getting regular exercise, and there are natural supplements you may also want to consider. Omega-3 fatty acids are one of those. 5-HTP, vitamin D, things of that nature. I provided a link to an article that will guide you around natural supplements for your teenager. They may improve their mood in a positive way. Also, you want to consider if your teen is dealing with what I call situational depression. It's different. It's not a neurological disorder. They may just be dealing with circumstances in their life that are applying a great amount of stress to them. They may just be dealing with a lot of stress in life. And if they are to make some lifestyle changes, maybe their mood would improve. So you also want to work with them and consider what's not working in their life, what's causing them extreme stress on a daily basis, and start to look at how to remove or improve those factors for them. Now, the other thing I would suggest for teens is that they have some type of counselor or therapist that they can speak to on a regular basis to voice their emotions and what they're dealing with. Sometimes it's hard for them to talk to parents depending on the relationship. And if you're looking for a therapist, I would suggest someone who's trained in what's called cognitive behavior therapy. It's a type of therapy, but it's a little more action-based than other therapeutic methods. So it actually has someone taking action and making some lifestyle changes, and that can really dramatically impact their mood in a positive way. If your teen does go on an antidepressant, which is very valuable for some. I don't want you to get from my coaching that antidepressants aren't valuable. They are valuable and they are important, and some people really need them, especially people who are in really dire situations. A teenager who has been depressed for many years and hasn't been able to deal with it and shift things for themselves, and maybe if they're eating healthy, exercising, they're doing all the things they need to do, they may have a neurological issue. We don't really know. So consider your situation and educate yourself. And if your teen does go on a depressant, here's what you really need to do is monitor them carefully and have them monitored by their medical professional carefully as well. In the first few weeks that they're on the antidepressant, they should be monitored. If the dosage is ever changed, they need to be monitored. So I do think that it is not something to walk into lightly. It's something to consider all the variables involved in what taking an antidepressant means, and consider the individual's personal case, and then make your decision.